This is the Daily Medical News by MD Edge, where we bring you audio versions of the top stories in clinical medicine from MDEdge.com. I'm the voice of MD Edge Podcast's Nick Andrews. Coming up later, our top story, intensive blood pressure control did reduce dementia. However, brain atrophy and also hurt cognition. We're also going to report the rate of uninsured patients and take a look at the 2019 flu season. But we begin today with harsh criticism for those rationing insulin. The practice of insulin rationing because of cost by people with type 1 diabetes is considerably more common in the U.S. than in other high-income countries. It is also even higher than in some low and middle-income countries. This is according to the results from the latest survey conducted by T1 International, which is a nonprofit advocacy organization. The results were presented at the 2019 annual International Diabetes Federation Congress. There were nearly 1,500 total respondents from 90 countries. Overall, 18% of respondents reported insulin rationing in the previous year because of cost. 26% of the American respondents reported rationing. Researchers say that the take-home point is that insulin rationing and blood glucose testing rationing is a reality for far more people than people think. And the number of uninsured people grew in 2018 as the rate of healthcare spending also grew. This is according to updated data from the Centers for Medicare and Medicaid Services. A total of 3.7 million people in the U.S. were uninsured in 2018, which is up 1 million from 2017. It was the second year in a row that the number of uninsured grew by at least 1 million. The CMS data showed that the newly uninsured patients came mostly from the private sector, which saw the number of uninsured decrease from 202 million in 2017 to 200 in 2018. The increase in uninsured people comes as the growth rate in healthcare spending rose to 4.6% in 2018, up from 4.2% in 2017, although much of that growth was attributed to the application of a health insurance tax in 2018 that Congress actually put a moratorium on in the previous year. The tax is part of the Affordable Care Act that was enacted back in 2014. Also contributing to the rise in the rate of uninsured was faster growth in medical prices. Despite this growth in the rate of spending, healthcare spending as a percentage of GDP fell slightly from 17.9% in 2017 to 17.7% as the GDP grew faster than healthcare spending in 2018. And it's time to take a look at the 2019 flu season numbers. It has been a decade since the flu activity levels were this high this early. For the final week in November, outpatient visits for influenza-like illness reached 3.5% of all visits to healthcare providers, according to updated data from the CDC. That is the highest pre-December rate since the 2009 pandemic, but that pandemic had much higher rates. The rate peaked at 7.7% in mid-October. The CDC reported that 8 states and Puerto Rico reported high levels of activity. That's 10 on a scale of 1 to 10 from the CDC. There was one pediatric death reported related to influenza. It was reported for the week ending November 30th, which brings the total number of deaths for this season to 6. And finally today, intensive blood pressure control over 4 years reduced the overall risk of all-cause dementia by 17% compared with the standard care. However, in a sub-analysis, intensive blood pressure was also associated with significant decreases in cognitive function and total brain volume. The sub-analysis was part of the Systolic Blood Pressure Intervention Trial, or the SPRINT trial, that was reported at the 2019 Annual Clinical Trials on Alzheimer's Disease in San Diego. Dr. Mary Sano is professor of psychiatry and the director of the Alzheimer's Disease Research Center at the Icahn School of Medicine at Mount Sinai in New York. Dr. Sano voiced her reservations about clinically meaningful these findings were. She said that the cardiovascular effects of SPRINT were indeed impressive, but she is concerned that the field is minimizing the potentially negative effect on cognition. She supposed at the meeting, why treat a healthy, non-impaired patient like this if one has to warn the patient that their cognition could get worse? There is very strong evidence that intensive blood pressure treatment might be a backward step for cognition. She then asked members and co-panelists, would you lower your own blood pressure at the risk of losing some points on your cognition? The sub-analyses were conducted as part of the SPRINT MIND sub-study, which looked at cardiovascular and mortality outcomes in more than 9,300 participants whose hypertension was managed intensively or by standard care. The trial was stopped early because of a 25% reduction in primary composite cardiovascular disease endpoint. SPRINT MIND examined the risks of incident probable dementia, mild cognitive impairment, and a composite outcome of both of those. Intensive control reduced the risk of mild cognitive impairment by 19% and the combined outcome by 15%. At the conference, the investigators presented 3 long-term sub-analyses, and follow-up was 14 years. And that concludes this edition of the Daily Medical News. For MD Edge, I'm Nick Andrews.